Hello everyone, this is Dr. Kant Shah here, Pediatric Surgeon, and today we are going to talk about 2 and 3 staged hypospadias repair, what it means, when we prefer this approach to a hypospadias repair for a child, and what the parent should expect from each stage of this repair. Firstly, just a quick recap, a hypospadias is a condition where the whole of the urine passage called the urethra is not at the tip of the penis. Many a times associated with other problems such as a bend in the penis called a chordae, and many a times also the tissues which are meant to be a urethra are actually completely not formed. Hence, when a child has hypospadias, we may either do nothing, choose a single stage repair, or offer a 2 or 3 stage repair. Now, a stage repair brings a lot of anxiety in the parent's mind because, of course, anyone would like to get away with a single surgery and nobody would like multiple surgeries for their child. But it is important to understand what are the deciding factors and what are the advantages of a stage repair. The need for a stage repair usually occurs because the quality of tissues available for reconstruction of the child's urethra is not great. We need to borrow tissues from nearby areas, and the bend in the penis is severe enough for us to need to make a very long tube. There are 3 common conditions where we offer a stage repair. The first is a bend in the penis or a chordae. When we try to correct a bend in the penis, the actual position of the urethra what the child is born with, as soon as the bend is corrected, it drops down, and hence the need for a tube is much longer than what it would seem on primary examination of the child. A longer tube means a need for a lot of good healthy tissues, and this usually requires a stage repair. If the bend or the chordae is easily corrected, then we offer a 2-stage repair to the child. If the chordae is severe and we have to do a specialized repair for the chordae, then this chordae repair or the repair for the bend in the penis is offered as a vital 1st stage surgery followed by 2-stage tube construction, making this a 3-stage surgery. The second most important criteria for choosing staged repairs of hypospadias is availability of the tissues for reconstruction. To make a urethral tube, we need soft, supple skin, preferably one which does not bear hair, which is usually found in the inner layer of the foreskin or of the inner lining of the mouth or oral cavity. When such a skin is to be used, we prefer to first lay it down as a graft on the penis and then 6 months later roll it into a tube to minimize the complications. A broad, rectangular, soft, supple graft has far less complications when you roll it into a tube, and hence this is called a 2-stage repair. The third common condition where we offer a stage repair is a child who's underwent multiple surgeries in the past, causing a lot of unhealthy tissues which we may have to remove, then put a graft which will give us a nice rectangular patch of skin which will be rolled into a tube in the next stage. And hence in redo repairs also, many a times we recommend stage repairs. So what should parents expect after each surgery? Well, after each surgery, there is a catheter or stent kept in place for 10 to 15 days. There will be a dressing. The child will undergo one dressing change on 3rd or 5th day after the surgery in hospital, after which the child can go home with the catheter and then come back later to remove the catheter. The healing in such cases is much easier for the child, and the pain is more tolerable if a very large repair is divided into 2 or 3 stages. Children usually just need simple painkillers and antibiotics, and apart from these, not much other special care is required from the parent's side. The long-term outcomes of a stage repair, both in terms of cosmesis, function, and also in terms of complications, are far superior to some single-stage repairs. So to summarize, stage repairs for hypospadias, when suitable, are safe, are easier for the child, are easier for the tissue healing, and offer a far better outcome compared to single stage repairs. The stage repairs have 3 components: correction of the bend in the penis, laying down a rectangular piece of skin called a graft, and then tubularizing that graft into a tube. Each stage has the purpose to make the tissues stronger and give a more natural outcome. I hope this has been helpful for you to understand why we recommend staged hypospadias repair. If you have more questions, then please do write them down in the comment section below and I will try to answer them. If you like our videos, then please do like and subscribe them. Thank you.